Our behaviors are modeled from our environment, and in order to change our behavior, all we have to do is kind of reinforce and condition those things. For example, using the techniques of classical conditioning or operant conditioning, right? So if we remember classical conditioning associated with Pavlov, that's the idea that if you pair a stimulus with a kind of response, the food with the bell, you could lead the bell itself to lead to salivating. So again, the food causes salivating, you pair the bell with the food, and now the bell leads to salivating. And so they believe that most psychological disorders is a case of you just pairing up the wrong kind of stimulus and responses. Compare that to operant conditioning, which is the idea that we could use reinforcements and punishments to change someone's behavior. So whether you reward them or punish someone, that's going to lead to different kinds of outcomes in their behavior. And we looked at earlier on that this kind of reinforcement can lead to the kind of disorders such as phobias, obsessive compulsive disorders, and what else? Addiction, like that. So the behavioral approach is really less interested in the mental process and more focused on the behavioral changes. They really don't care about why you develop your fear of horses, or they don't care why you developed certain kind of phobias or depression. They're thinking of like what you can do to change the behavior, because the symptoms themselves is the illness. If you're sad, you're just because you're sad. It's not because you have an unresolved conflict with your mother that caused you to be sad. Right? So in behavioral approach, they're more interested in just fixing the symptoms right there, because that's the thing that you could change. So just to give you a quick, this is just a quick recap of what classical conditioning and operant conditioning is. Pairing of stimuli, reinforcement to encourage or discourage behavior. So how is it that using the behavioral approach, we could change someone's kind of, it could be used as a therapeutic approach? Okay, so for classical conditioning, they use the ideas of counter-conditioning. So if you're conditioned to be afraid of something, to be afraid of heights, afraid of snakes, they would do the reverse of it, counter-conditioning, to remove the learned association between those two items. For example, if you're afraid of snakes, and the fear of snakes is very irrational, that even thinking or seeing a picture of the snakes can cause you to freak out and have an emotional breakdown, then that's kind of a disruptive behavior. How is it that we could lessen this connection between the snakes and fear? And so there's two kinds of exposure therapies that people use. For example, exposure therapy basically is the idea that if I slowly expose you to this thing, and you could control each step of the way, by exposing you to you can learn to disassociate the learned fear that you've developed earlier with the snake or whatever it is that it is. The first one I want to talk about is systematic desensitization. This is a very interesting one. And basically in systematic desensitization, we have a step-by-step exposure for you to be afraid of something. I'll give you an example. So, for example, if you're afraid of snakes, so what I do is like step-by-step expose you more and more to something that's more like snake-like. For example, at first I'll do the word snake, and then maybe a picture of a snake, or it doesn't look like a snake at all, but please excuse my drawing. It looks like a giant snail. Or maybe imagine yourself looking at a real snake, and then so on and so forth. In little baby steps, you actually then encounter an actual snake. And so what they have is that in each step of the way, we have kind of targeted relaxation. There's like a progressive relaxation technique. That, are you okay with seeing the word snake, or does it elicit kind of fear? And maybe it elicits a little kind of fear, and so you learn to relax just by kind of, you learn techniques to control your fear, for example, breathing, relaxation, and maybe thinking that it's not really that dangerous. And so every step of the way down the chain, you're going to be more increasingly able to control your emotions, such that there will come a day when you could actually see a snake, approach the snake, touch the snake, and step by step become more relaxed and be able to do that. So in that case, we remove the systematic fear. So again, why is it called systematic desensitization? Is that step by step we remove the increased excessive sensitivity that we've developed to the snake or whatever target it is that you're afraid of. Now, for those who are even too afraid or too, it's not cost effective to deal with in the therapy room, for example, if you're afraid of heights or afraid of flying, then you can't really imagine these things or replicate these in the therapy room. And so what they do is use virtual reality. Here I have a picture of someone using VR glasses, and this is what they see. They see themselves in an airplane, and they kind of experience what it's like to be in an airplane. And they use this kind of similar idea, which is use a step-by-step progressive relaxation technique, and to kind of desensitize you to the actual fear involved in whatever it is you're doing. So basically, you could see exposure therapy as basically a training method. They expose you gradually to the item you fear, and that you have a training and coping mechanisms to deal with the anxiety that arises from that, right? The next one is aversive conditioning. This is kind of the opposite of this, which is why if you have a natural attachment to something that is harmful to you, for example, drugs or drinking, we want to counter condition that by pairing that up with something that's negative and unwanted, unnatural stimuli, something that makes you, for example, nauseous. So like a simple example is for those who chew their nails, to bite their nails nervously. One way you could stop yourself from biting your nails is to put, say, nail polish on them that tastes very bitter and would make you sick. So every time you chew your nail, you'll feel sick and nauseated, and so you counter condition yourself that, and in the future you know how to avoid it. So basically, aversive conditioning is pairing a neutral stimuli with a conditioned stimuli for conditioned response, and you want to pair it with something that you unwant, like nausea, that causes nausea, like with smoking, drinking, and thumb sucking. There's an example I put up here is from the movie Clockwork Orange. For those who haven't seen it, this is a movie by Stanley Kubrick that kind of takes place in the future, where people develop kind of really aggressive, violent tendencies and habits. And so one thing they want to do is deprogram people from being violent. And so what they do is kind of pair up violent imagery with an unnatural, nauseating feeling. So they would kind of strap them in a chair, force them to open their eyes, and watch kind of violent movies while they inject them with chemicals and make them feel generally very, very uncomfortable. And so every time that they want to act violent, it's naturally paired up with this feeling of nausea, that, oh, and you feel sick. And so those people are more likely to avoid violent acts. Same thing with these tasks like smoking, drinking, and thumb sucking. If you want to make someone stop sucking their thumbs, again, you'll just put something like bitter and nauseating on their thumbs every time they suck it, instead of creating like a comforting feeling that they've known to associate it with, right? Why do they suck their thumbs? Maybe they're under stress. They've learned this as a behavior to cope, that it's something somehow comforting to them. If you turn that into an uncomfortable thing, they will learn to dissociate that.